Another big story that we're following as part of News 2's COVID-19 watch. The health department has now detected 2 cases of the UK variant of COVID-19 in the metro area. The head of the infectious disease department at Vanderbilt Medical Center saying if there are 2, there must be many more. News 2's Stassi Olmos is live for us now there at that location. And Stassi, what does this mean?
Well, Eric, studies from the UK have found that this variant of COVID-19 is much more contagious than the original strand that we have here. Now, the Tennessee Department of Health announced 2 cases 2 weeks ago, and today Metro Nashville announced that we now have 2 cases here in Nashville. But doctors here say that this thing is so contagious, there's no way we only have 2 cases.
I knew it would happen because this British variant is out there. It's very contagious. I knew it was just a matter of time before it would find a home here in Nashville.
Dr. William Schaffner with Vanderbilt University has been studying COVID-19 since its very first case 1 year ago.
COVID is a roller coaster.
Just as we climbed out of the holiday surge, the Metro Health Department announced 2 cases of the variant from the United Kingdom now in Nashville.
It'll spread more widely. It will hit more people who are older, other people who have underlying illnesses such as diabetes, heart disease, lung disease, and the like. So we may well see, once again, a surge in hospitalizations because of the widespread nature of this new variant.
Schaffner says the symptoms are the same, but much more severe. While the health department's reporting 2 cases, he says the strain doesn't show up on a basic COVID test, meaning there are likely more than 2 by now.
Determining which strain you have, which variant, takes extra laboratory work. So we're not testing all that many people. We have 2 cases in Tennessee and 2 additional cases now in Nashville. There are probably plenty others that we don't know about.
The good news is that the existing Moderna and Pfizer vaccines should protect from this variant. However, less than 8% of the state has gotten at least 1 dose so far.
At the moment, the vaccines will cover all of these variant strains. But is it possible that down the road, we may have to change our COVID vaccine the way we change our flu vaccine each year? That's possible. All the more reason to wear the mask. These things really do work. Social distancing, avoid groups, please.
Now, it's not 100% known if you can still get this variant if you've already had COVID-19, but Schaffner said it's all the more important to be aware, make sure you wear your mask, social distance, and if you have these symptoms such as difficulty breathing, be sure to seek help because these antibody treatments really are saving lives. Reporting live here in Nashville, Stassi Olmos, News 2.
It gets more complicated. Stassi, thank you for that update. New tonight, another big jump in the number of Tennesseans who have died from COVID-19. The State Department of Health reporting 169 deaths in the past 24 hours, bringing the total number to more than 10,200. This is Tennessee's 4th straight day reporting 100 or more deaths.